Have you ever felt that deep burning pain, sometimes sharp, between the shoulder blades in the upper back and the mid back area? And no matter what you do, whether you've tried massages, those foam rollers, or even the posture correctors, those different things, it doesn't seem to work. Everything just keeps coming back and the pain keeps returning, so you don't know for sure what to do. You're not alone. This area is one of the most overworked, misunderstood, and neglected areas of the body. In today's video, we're going to go into why that pain keeps returning, what can you do, why posture correctors may not be the answer, and let's get to the root cause of the problem so you can take care of that and the pain can either be diminished or completely eliminated. You'll also learn in this video various techniques, tools, tips, and self-care such as stretches and exercises you can do to help address that problem and take care of it so it doesn't keep returning. There are symptoms that come along with the upper and mid back you may have never thought of that are related to that compression and everything that's pulling down in the front of the body when the backside gets stretched and causes the pain in the mid back and the tension that increases in that region. The first symptom you may not relate to upper and mid back discomfort and pain can be digestive symptoms. When this whole area in this region is compressed, your intestines are compressed, your stomach is compressed, so what it does is it reduces the space needed for peristalsis, which is the contracting and relaxing of your intestine that moves the food through to get the nutrients it needs. So when that space is decreased, it also decreases the ability to move freely like it should through the food through your system and get the nutrients it needs. You may end up with things like constipation, digestive discomfort. Maybe there's areas that hurt a little bit more than others, like things just aren't moving quite right. So that is definitely one that can be affected by the area. Another region affected very closely to the digestive system is your lungs and how you breathe. When the upper back, just like the digestive system, when the upper back and the mid back are compressed and brought forward, it compresses in on your rib cage and also compresses in on your lungs as well. So you may not be getting that full breath you need just because everything is getting compressed. And there's also connective tissue and muscles between the ribs called the intercostal muscles. So when those also get compressed, it gets harder and harder to kind of take a deep, full breath. And you may be even breathing shallow and not knowing about it until you take a deep breath, and then you feel like a rush of oxygen getting into your system. But when everything's compressed and you're breathing very shallow, very light, and not deep, then the oxygen can't get through the system like it should. Other areas include neck and low back pain or problems, because there are muscles that run from the base of your head all the way down into your pelvis called the erector spinae muscles. And when there is a restriction in the middle, in the upper back, actually anywhere along those muscles, it can pull on that area. So areas are going to compensate all over your body. And if you have problems going across your upper and middle back, it is eventually going to get into your neck and into your low back and hip. And then pretty soon it's like, okay, where did this problem come from all of a sudden? It was just in my back. Why does it keep moving around? And the body compensates. So instead of walking around like this all the time, you end up going like this. So that way you're still in the center. So the body's a compensation machine, and it will adapt to areas that are under tension and under pain and under pressure in other areas. So then the pain starts spreading out into different parts of the body. Another area to think about is nerve compression. When that area is compressed in the upper and the mid back, what it does is it starts compressing down on the vertebrae and the disc between the vertebrae. And then of course in between the disc and the vertebrae are nerves. So when those nerves are getting impinged and compressed, it is slowing down the signal, it's irritating the nerve, and it actually could start your body into an inflammatory response. And that also, what that can do is cause numbness or tingling in other areas such as your arms and your hands. So that is something to think about. Another area that's also affected is the vagus nerve. The vagus nerve is responsible for our fight and flight. When that gets irritated and not working correctly, your body stays in this constant fight or flight, chronic stress state, making it so you can't sleep. If you can't sleep, your body can't repair from the day, and it creates this cycle that just feeds on each other. So many people think that, oh, my muscles are tight in my upper back. It's just my muscles. The muscles are only a piece of the puzzle. If the connective tissue, if the nerves, all of those are also getting irritated or compressed, that can cause problems with the muscles and how the signals go to the muscles. So you want to make sure that you're also addressing that area as well. Another thing I see very common with my clients, it doesn't even matter the age. And I notice it's showing up in younger and younger generations. And what it is that physical symptom of the hump in the back where you curve forward. So your body starts getting this upper body hump and then you curve forward. There are literally some people, especially when they get older, when I'm doing a stroke down their back, it's like going up over a hill. So I start here at their neck, and as I go down, I literally go up and then go down like that. And that's all due to that upper body curved forward, because the body gets stuck over time. The body gets stuck in that pattern. And if you don't break it out of that pattern, that compression, everything just keeps going like that. And then pretty soon your ligaments, your connective tissue, your vertebrae, everything starts falling into that pattern. And the longer it goes, sometimes the harder it is to break out of that pattern. So it's very important to address that, especially is the younger you are, because you want to prevent that. And of course, no matter what age, you want to address that and take care of it. One thing I get asked a lot by my clients when I explain the connection with their upper back pain is they say, how did it happen? What are the causes? Well, one huge one is posture related. How are you sitting? How do you sleep? How do you relax? All of that goes into how your body sets up a pattern. Because if you're sitting at a computer all the time and your arms and hands are forward like this, you're already going like this all the time. And so to the point, your shoulders actually start rolling forward, which is creating that hump in the back. And what's surprising, a lot of people think, oh, if I just massage this out, that doesn't work. The pain comes back, because what happens is when this is happening, all of these muscles, they're not getting tight from being overworked. They're getting tight from doing what they're supposed to do for the body and keeping the body upright. Because you're like this, all of these muscles are actually getting stretched out just like a rubber band. And if you keep massaging that rubber band and keep lengthening and lengthening and lengthening and lengthening, it just keeps stretching that out. So you just keep going forward. And what needs to be addressed is the compression in the front that's causing this compression downward. Because the more you sit like this, the more this pattern is going to stay in memory and stay in your body. And then also, what are you doing when you're sitting at your desk or at home for long periods of time, especially on the computer? Do you tend to sit and lean to the side on one arm of the chair? Well, you're doing this, so you're creating this side S situation going on with your spine. And sometimes maybe if you don't have your chair completely centered in the middle, a lot of times with people I see where a hip is rotated forward and this side is rotated forward, or sometimes it's both sides rotated forward, especially moms. I notice when they carry their child on one hip, they usually jut one hip up and forward, and then of course they're hanging on with the other, so it creates this compression and a forward movement like that. So our daily mechanics as far as what we do is very important. And then also we want to remember when we go into our sleep, how are we sleeping? The back to me is the most ideal, because you're not trying to shift on your side, because when you lay on your side, what it's doing is it's creating these dips in your spine unless you have some type of support underneath your low back, underneath your neck, between your arms, and between your legs. Because with gravity, if you don't have that, if you're laying on your side, your spine ends up going like this just because of gravity pulling down in those different areas. So you have to have everything nice and supported. So a lot of people not only work at the computer, so they have that going on during the day, they don't stretch it out, they don't work out, they don't drink water like they should, they take it into their sleep, and then they sleep like this. So it's 24/7 that their body is doing this. So that will add up over time and create a pattern that gets pretty stuck. The second contributor is fascial restrictions. Fascia is like a saran wrap. It's a strong connective tissue that's around everything. It basically what supports our body and keeps us together. And when that fascia does not get enough fluid, what can happen is it becomes sticky. And the stickier that fascia gets, the more dried out and compressed and squeezing down that it causes. And so if you're sitting in that position, you're not moving, you're not getting up, you're not drinking water like you should, none of that, and you're staying stuck in this position, and it wouldn't have to just be sitting. It could be a hairdresser. It could be anybody where this position is forward like this. So if you don't move and get out of that position and stretch and do the things I'm going to show you, it just will keep going, and then pretty soon you'll have this physical hump on the upper back like what I was talking about earlier. So the fascial restrictions is when you're sitting like this, it's getting dried out through here. So the more dried out it gets, the more compression it gets. And again, fascia is also in between with our intercostal muscles in between our rib cage. So you want to make sure to address all of this area too. Sometimes our breathing mechanics can be a contributor to the issue, especially if we tend to naturally breathe shallow anyway. Sometimes I've noticed, especially when I get very focused on something, I tend to breathe more shallow just because my mind is focusing on something else, and I don't really notice it until I naturally take a big deep breath and realize how shallow I was breathing. So you want to make sure to, it's kind of funny to say, but remember to breathe. Take times out through the day and just take a deep breath. Get that oxygen in your system and get that your mid-back and your rib cage going, expanding and contracting, because that also increases the fluid in that connective tissue and the muscles to that way, so the rib cage goes up and down and can still move, and that's extremely important. And of course, another big factor is stress itself. I know we hear a lot of doctors and medical profession focus on how stress affects the rest of the body and how it contributes to a lot of pain, a lot of medical conditions, and that kind of thing. So, and it's very true. When I work on people and they're under a lot of stress, that stress, how they guard their body is like an armor. And it's a subconscious thing. We don't even think about it. So you may have heard the term, oh, I carry my stress in my neck. I carry my stress in my low back. I carry my stress between my shoulders. It's known that stress tends to go to certain areas. I know when I was going through my training, they brought up we carry our issues in our tissues. And I have seen this with clients I worked on. There was one gal a long time ago that I started working on, and I could just tell. I'm an empathic person, so I pick up on people's emotions and that kind of thing very easily. So I could tell she was just stressed, and I was working on her, and she could not relax. I can't force somebody to relax and release. It has to be a conscious thing that they have to want to do on their end. And when they're stressed out and they're worried about something, they're unconsciously guarding. So as she was laying there and I was working on her, it just felt like she was hanging on. Like her entire body was just armor and she was not letting go. And as time went on, she started to talk about her life, what was going on, and she brought out that she was very stressed about some things her son was doing and how, she didn't agree with it, and it was causing her a lot of emotional turmoil. So as she started talking and letting this out and releasing all that, her whole body just naturally released and relaxed. So it wasn't anything I did. It was something to do with how she was holding on to that emotional turmoil that she was going through. And then I've had other clients where I'll work on them and I'll do something on their arm and I'll go up into their hands, especially the arm is a big one I've noticed because people guard up through here a lot. So I'll work on their arm and they'll hang on to their arm and I'll have to loosen it for them to relax it. And 99% of the time they're like, oh, sorry, I didn't even notice I was doing that. I even do it myself and I should know better. But it's a very common thing. We hang on, we guard, we protect, especially when we've been in a lot of pain. Our pain is chronic, our nervous system is overloaded, we've been stressed out. That sticks with your body more than you think it does, and it will stick in the patterns as well. Sometimes when there are releases in the body, people can start crying. People can get angry. I've had different things where I'm working on the psoas in the hip or up in this region, and people are like, I'm angry all of a sudden. I don't know why I'm so mad. You'd be surprised what goes on with our body. Our body has a way of healing itself, and there are many layers to it. It's not just muscle and bone and everything like that. It's an interconnection. It's an integrative thing that you have to address all of it. And that's when I work on people. I don't just look at the muscle. I treat every area as an interconnected region, including the connective tissue, the lymph, the fluid, the circulation, and especially the nervous system, because it's extremely important. I want to take a minute and talk about posture correctors. Posture correctors may seem like an easy fix because on the surface, you put it on and then it pulls your shoulders naturally back. And so it's like, hey, it's working. My shoulders are back. I'm standing straighter. But what happens when it's taken off? Because the body has those patterns, it has that memory. When it's taken off, everything comes back. Because what happens is it's not fixing the root cause of the problem. And the root cause is this compression in the front, stretching in the back. So once you fix that root problem, your body will naturally align and naturally stand up straight, and you won't have to think about it because the muscles that should be strengthened are strengthened. The muscles that are compressed are lengthened, so that will open up and let that out, and that creates a lot of release of tension, pressure, everything. So the brace, the posture corrector brace, can do that. It can make you feel like, hey, this is what it's like to stand up straight, but it's not going to fix it. It's like putting a Band-Aid on something or taking an aspirin. It helps with a symptom, but it doesn't make it go away. It doesn't solve the underlying problem. And through these various techniques I'm going to demonstrate here in a little bit, I'll show you that by doing those techniques, it will get to the root. And you will notice a big difference in how you start feeling in your upper and your mid back and even in the front of your body. I want to take a minute and address the feeling of pain. Pain is your body's way of saying, hey, something's out of balance here. We need to get back in alignment. What is going on? Let's get to this. And a lot of times, just because you feel the pain in a certain area, for example, you feel that pain between your shoulder blades, you feel all this going on. Granted, there's tension there. There is tension there. I'm not saying that at all. That's the symptom, is the pain where it's located. But that's not the cause. The cause is because of this compression here in the front, stretching out the back. So many times people think, oh, because a muscle is tight, it's compressed and everything like that, I got to loosen that up, and that's what's causing the pain and the problem. But it's not. It's the muscle that's getting stretched. So you've got to get the tension off of that stretch, that rubber band, because when those muscles with the tendons are connecting into the bone, that rubber band, where it's connecting to the bone, and that muscle is getting pulled and stretched, it's pulling on the connection of the tendon to the bone. So with all those nerves and everything in that location, it's going to hurt. So you're going to feel it. Eventually, you're going to start feeling areas down into your joints. I see that quite a bit, where I will work on someone, especially up in this area in the upper back, when I'm working on the front, it gets down into the joints. And then if you let this go on long enough, then it's not only joint, it's not only the front and the muscle here, it gets into the ligaments. So that's bone connected to bone. And what can happen is you may end up, if you don't address it, you could possibly end up with shoulder problems. I have a lot of clients that have went through frozen shoulder, and it's very painful. It takes a long time to recover from it. It's not an easy thing to do. So the more you can pay attention to when your body starts hurting, sometimes if it starts hurting a lot, it's pretty far along. If it's something where, hey, I'm starting to feel this discomfort, you really need to look into it and figure out where the imbalance is before it goes any farther. Because when things aren't addressed, eventually, and I'm not a doctor, I'm not saying this will happen, but it's something I've seen in my clients, that if they wait too long, that there will be effects on the joints in the low back, down around the sacrum, down into the shoulder joint area. So you want to make sure to pay attention to that pain. It's not always a bad thing. It's the way of your body trying to get your attention to solve something and prevent something in the future. Now I'll walk you through some simple stretches, exercises, and different techniques that you can do at home. And you want to remember, this isn't about forcing your body. I always say when I do massage and do body work on people, I don't force, I facilitate. A lot of times people think, oh, you got to get in there hard and create that pain, because no pain, no gain. That's not always right. I get a lot farther when I sink into people's tissue. I facilitate, I listen to the body, I don't force it. Because if you force it, you're going to trigger that nervous system to guard and reflex. And if you go too hard, you can create more micro tears and increase the pain, causing more problems in the end. So the more you can facilitate with your body, the more you listen to your body, the more you work within its range that it can do, the better off you're going to be and the better you're going to feel. The techniques I'm going to discuss cover a 360-degree approach. It covers the back, where you feel the pain, feels the sides underneath, and then it also will cover things you can do in the front. And you might really be surprised how much better you feel and how much that pain is taken off the back when you work the sides and the front, because it has such a huge impact on your rib cage and your whole upper thoracic spine. The techniques I'm going to cover include myofascial release, trigger point release, and then also spinal decompression. Myofascial release is a technique that specifically works with the fascia. And the fascia, as we were talking about earlier, is the saran wrap that covers everything. And when that gets restricted, it causes problems, and then the fibers don't line up like they should. And especially if you have had an injury, what happens is the scar tissue that develops, it doesn't lay down in this perfect parallel fashion. When it lays down and heals, it just on top of each other, more like a crisscross pattern. So when it's in that crisscross pattern, the fluid doesn't get into it like it does when it's nice and parallel. So what myofascial release does is it realigns those fibers and it breaks up that scar tissue, and it makes it so the fluid can get in the area, and thus increasing the mobility. And that's extremely important for that. And then the other one, trigger point release. What trigger point release does is it gets on areas such as here in your pecs. There are different spots that when you feel them, they will trigger down into your arm, or they'll just be extremely sore. They don't even have to refer anywhere. But what it is it's just a tight band of hypersensitive muscle. And when you get that to release, you'll feel it, and the muscle will just relax. Eventually, the area that was getting the referred pain, it will quit getting referred pain. And sometimes you can feel pain, numbness, or tingling in a referred area, and that should go down once that trigger point is released. And when we do a trigger point, we want to sink in slowly. We don't want to force. It goes back to what I was talking about earlier and facilitating and not forcing. So trigger point is something you want to really sink in. Even myofascial release, you want to work with the body, feel what's going on and sink in. And if you are very in tune with it and really quiet your mind, you can start feeling when the body starts shifting and moving as you sink into those areas and everything starts releasing. And as far as the spinal decompression, what that will do is it will address the symptoms like we spoke about earlier about the nerve compression. It will help open up that space in between the vertebrae, allowing the disc to have more room and taking the pressure off the nerves. And then once you do that, then the nerves can start firing correctly. Fluid can get in between your discs, in between the area, and then you don't feel so compressed and have the tension there. And as we do the techniques, you might notice different feelings. I know sometimes when I've worked here on the front of my rib cage, I will feel tingling up in my face because everything's connected, especially the fascia. It's like a spider web. If you affect one area, it pulls on everything else. So you'll feel it in other areas. So you'll feel that, or you may feel that, I should say. And then also you might notice a shifting down in your hip and your pelvic area and up in your shoulders and your neck, because when you start releasing the trigger points, start releasing the fascia restrictions, all of those areas, what it does is it starts shifting the rest of your body. And if you do these techniques over multiple days, each day you'll notice something different about your body. Because one day, say, this area hurts, and then after you've been doing the techniques for a couple days, oh, I get this weird thing down in my ankle, or now I feel this weird thing over here, or something with my toe. What that is the fascia, the connective tissue, that spider web is unwinding and realigning, so that way your body can be more in the center again. So naturally, the areas you didn't notice before were actually restricted, but other areas needed to be addressed first. And once those areas are addressed, then it just creates kind of a domino effect through the rest of your body. And so as time goes on, you start feeling the changes in different areas. Doesn't mean that something's wrong unless you do have a serious medical condition. Please get that checked out. But you may, like I say, you may feel different things here and there. That's not necessarily cause for alarm. That's actually a good thing. It just means your body's trying to get straightened out and you're doing well. The first step in our technique process is to see where you're at as a baseline. So you have to have a starting point. And this is one of those things where it can be a before and after situation. Maybe even take a picture. Have somebody take a picture of where you're currently at. And then notice, either in the picture or in the mirror, where your body sits. Do you have a hip that's coming up on one side? Do you have it rotated? Is it going down and forward? Do both hips rotate down for anterior pelvic tilt, which puts more compression on your low back? Where's that at? So what happens? Maybe you shift your hip back and feel the difference in your low back. It's very surprising the different things can happen as you shift things around. Also, what you can notice is in the hip area, in the pelvic region, I should say, you can notice if you tend to shift to one side. This can happen a lot with side sleepers, or if you are leaning to one side in a chair, or if you're a mom. A lot of times the moms will carry the child on their hip, so they'll jut the hip out as kind of a ledge, so eventually it makes their hip shift to the side. So that is something to pay attention to. Look where your abdomen is at. Does it look like it's compressing down here under the rib cage? Does it look like it's shortened? Is it shortened more on one side than the other? That's another thing too. We don't always have an even thing going across our entire body. One side will be different because of that compensatory pattern that happens throughout our body. So then just work up your body. You can notice where your shoulders are at. Do both shoulders go in more? Is one down more than the other? That happens a lot too. When I work on people's upper back, on the client's back, in the upper area, one part of their shoulder blade, it's called the scapula, one part will be more winged out. So when this bottom part of the shoulder blade is sticking out more, that tells me the muscles, everything in front here, are getting rolled forward like that, pushing that shoulder blade up and back. So what that also does is it pulls on these rhomboids in the back, the muscles that go between the spine and the shoulder blade, the scapula area. it can pull on that. And a lot of people get, oh my goodness, I've got this pain between my shoulders, this pain between my shoulders. Well, yeah, there's tension there, but because of this rotating your shoulder down and forward, I can already feel, just do that movement and you will feel the pull that happens between your shoulder blades. So it's all connected. So make sure you look in the mirror or in the picture and see where your shoulders are. Are they like this? Do you tend to due to stress, hold your shoulders up? Do you let them drop down, or they feel like they're getting pulled down? If they're getting pulled down and stretched, that means everything under here is compressing, so pulling your shoulders down. So every time you try to bring your shoulders up, they go back down. So it can go either way. You're stressed, they come up. It's hard to get them down. So notice where your body is and all that. What you can even do too is, this is kind of more advanced, but notice how your arms hang. Do your arms tend to come forward, like swing forward naturally? That can point to different tension and that kind of thing in your arm or in your shoulder. Even down into the chest area, it can pull things differently. Notice your feet. Do your feet go out? Do they go inward? All of that from your very bottom of your foot all the way up to the top of your head. It's all compensating for different things going on in your body. So you will notice shifting. And what you may notice is this shoulder's up and then this side of your pelvis is up. So that way you're not walking around like this, your shoulder comes up. So this is compressed and this is compressed. Sometimes it's on the same side as well. I mean, I've seen all different things, but this is common to have opposite, because it usually goes in opposite paths. So if this is up, then the bottom underneath here will be tight and pulled and stretched as well. So just notice your body. Where are you? Do a pretend line, or even if you wanted to in the mirror, create a string and take it straight down, and then maybe use a level or something like that to see where that string is sitting, and tape the string at the top and the bottom and line it up to where you think your spine would be. And you'll start noticing different shifting and different things going on. It's actually quite amazing when you really dial in. Your body's a very fascinating machine, and how it compensates and naturally knows to stay upright despite different things it goes through, different stress, different accidents. People have been in car accidents, serious falls, and the body's compensating for all that. The body's holding on to that and functioning the best way it knows how by compensating in that alignment, which is creating the pain. So you want to take a snapshot, find your baseline, and if you really want to notice a difference, stand against the wall and mark your height. Notice where you're at with your height, kind of like your mom may have done growing up, where she was watching your height as you grew up and comparing. This is a very similar thing. Kind of mark your height either with a pencil or a piece of tape or something there. Have a friend or a family do it. Mark where you're at. And then after we do these techniques, the myofascial release, the trigger point, and the decompression, you might notice you have gained some height as well. This isn't a miracle to add inches and inches to your height, but you will notice there is a definite difference from when you started until the final, especially after you do this for a few days. And then also, you want to be patient with yourself, because if these patterns have set up for a long time, you're going to have to work in layers, and you may have to work through some emotional stuff too that comes out as your body is letting go of things and freeing you up. And it might make a big difference, more so than you think about, because this is such a core important area of the body, and it can be very intimate for a lot of people and very sacred. So when you open everything up, it opens up more than what you imagine it could be. Your breathing's better, your oxygen's better. All of that can contribute to more energy, a better outlook, all of that. So it'll be interesting as we walk through this to see what happens with your progress. You might even notice that when you get in the car and to go to work in the morning, you might need to adjust your rearview mirror more. because I have noticed that when I have done these techniques, and especially before I go to bed, this is another thing I want to bring out that's extremely important. When you work all day and your arms are forward and then you sleep on your side, you're taking your day into your night. So your body doesn't get a break from that position you've been in during the day. It needs that break. It needs a reset of that pattern. It needs a break of that pattern. And that way, when you relax, it not only loosens the fascia, the muscles, all of that, it's also a reset for your brain. Because when all of that tension is released, your mind will be like, oh, I'm going to let go now. Your mind can relax. Then you might find you sleep a lot better. So a lot of times the prime time I like to do these techniques is before I go to bed at night, because I don't want to carry that day into my sleep. And I notice when I do it, I get sleepy so fast. The body just lets go and starts winding down. I sleep better. My sleep is a lot deeper. It's more restorative because I've let go of that tension and everything that was in there. So as I was starting to say, when you get in your car to drive in the morning, so if you're doing these techniques at night for a few days, you go to get in your car, you might have to adjust your rear view. Because I've noticed when I've done it and I go to get in, I sit up higher. So I have to adjust my rear view mirror for that. And then also, just even throughout the day, as we go through our daily lives, as you sleep, fluid fills into the discs and everything, and it does kind of create an elongation. So you're tend to be a little bit taller in the morning. So by the end of the day, gravity and everything shrinks it back down. So you can give it a head start by releasing all of this and elongating before you go to bed. And then as you go to bed, those nerves won't be as irritated and as inflamed while you sleep, giving you a lot better rest. As we go through the techniques that I'm about to share, I'll be sharing items that can facilitate and assist the different stretches and the trigger points and different things I'm going to show you. And during different ones, I may show different options. It depends on the country that you're currently in as far as what you have available to you. So I like to incorporate different things no matter where you're at that you can find easily and that can help you out. And all the items I use, I will link in my description for easy access. I'm going to begin the technique process with a couple options that you can do, and especially if you're working at a computer at work during the day, there are different things you can do throughout the day to keep this opened up. And if you do anything throughout the day, this would be a good one. So what we're going to do is we're going to open up this whole area and down into the shoulders to get rid of this forward posture and everything pulling. There's two different ways you can do it. There's what I call a doorway stretch, where say this is the doorway, is going right here like this. So what you can do is completely go straight, put your arms on each side of the doorway, and keep your back nice and straight. You don't want to arch backwards because that will defeat the purpose. You want your back nice and straight, so don't start going like that. So then when you get into the doorway, you want to lean forward and stretch that way. Bring it up, lean forward, stretch that way. And then also I keep my legs pretty straight, and I just basically use the one forward leg to bend forward when I do it. And then you'll notice as you work up and you go all the way up, the more you go up, the more it will start stretching this whole area down through here. So when you start going like that, you'll feel it clear down in your abdomen. And that's a good thing because it's helping open everything up. And that's really important to do. And then what you can do too, if you have a wall or even in the doorway, and say when you looked in the mirror or took the picture, you notice one shoulder was doing this more. So this needs a little bit more help. So what you can do is just on one side of the doorway or a wall, you can use a wall too, like a wall corner where you just put your hand on it. What you can do too is put it straight out like that and then rotate your body and then turn your head the opposite direction. So when you do that, you get this whole stretch going through here. And then what you can do too is if you put your hand higher up on the wall or the doorway and you lean down into it, as you can see, it's stretching this area out. Because a lot of times when I work on people, because they're doing this and rotating forward, these muscles underneath here are getting shortened. So the subscap, all these muscles underneath get very compressed, get very tight because they're being pulled down. And a lot of times, you might be surprised, that's where a lot of people tend to hold their stress and their tension as well, is this whole shoulder blade area. So by getting up underneath here and going down, you help open that up. But it also opens up, if you're compressed on this side, it helps open up this whole area to stretch into that. And even just doing that without the wall, just demonstrating that way, my arms and hands are already tingling. So especially when you do this, you'll notice a lot of tingling that will go down into your hands and arms that wasn't there before. And you might notice you have more feeling in your hand and your arm than you had before, and you didn't even realize it was that way. Another good option I like to show clients to open up the front is taking a large bath towel. So because my arm span is so long, I take a really, really big one. So I just take it and I basically just create a long line with it. And I'll take it, I'll bring my legs apart, I'll take it right in front of me, and then I'll go back and then I'll pump it like 3 times and bring it forward. And when you go back, don't force it too much, because you don't want to create micro tears in your muscles and then have to have that repair and make it hurt on top of it. So work with your body. Like I say, listen to it. So pump it 3 times. When you go back, bring it forward. And then when you go back again, you'll notice you'll be able to go back even farther. So pump it 3 times, slowly bring it forward. And I've done this quite a bit. You want to just keep going in intervals as far as you can go back. And you may not do a bunch of them the first time because you may be so tight. So you can just do a few and go back as far as you can. And then the next day, come back and do it again. So eventually, when you get really mobile, you can go all the way back. So it stretches all the way to the front. And so you have full stretch out the upper back for you. So it takes the pressure off your upper back when you do that. And then what you can do too, to get into the sides, like in the doorway stretch I was talking about, you can take it up and then stretch like that. And that really gets into that whole side and up into your arms and your hands. And that also makes everything tingle. And as you notice too, it starts getting down into the rib cage and opening up that rib cage. And a lot of times you will feel one side is more tight than the other. One side may move, oh, I can do this, this is pretty good. And then when you go to the other side, it's like, oh, that's sticky. That's your body being compressed more on that side and needs to be opened up. So if you can't go very far, so you can only go like right here, do the same thing. Do the 3 compression, come back, and then do 3 again. And you notice you can go down even more each time. Because what you're doing is you're realigning that connective tissue, that fascia that I was talking about earlier. And sometimes it takes a little tender loving care to get that to start to release, especially if it's been chronic and been in that pattern for a very long time. And then what you'll see a lot of times is if there, as I was talking about earlier, there's a rotation in the hip. So your body may be going around like this and it's stuck in this pattern. So you want to unrotate it. So what you can do is take this and then rotate and then stretch too. So you're combining all of it and you'll feel how it pulls clear down in the lower part of your back and into your pelvic area. But the focus of this video, of course, is the mid and upper back. So the main area that you'll really feel it is, like I say, is right there through the rib cage, which is extremely important because that will get compressed too. And then that also can affect your breathing and different functionings, like what I was telling about earlier as far as the symptoms. Now I'll discuss a little bit of trigger point while I'm still standing up. Most of my techniques I'm going to show on the floor while I'm laying down. It's a lot easier to work because in that position, because you're not engaging a lot of the muscles, they're relaxed, and it's easier to work inside them. But what I'm going to show now is what you can do while you're still standing up is start working into the trigger point areas of the back. You can also do this laying down too. That works as well. Sometimes it's a little easier. What I'm focusing on is this area in the shoulder blade. Sometimes it's a little easier when you're standing up, and that way you can lean against the wall. Because what you're working in here, there is, especially when you're like this a lot, there is a ton of trigger points that end up happening in here, and it gets really, really tight and pulled. And yes, we're basically trying to loosen a rubber band, but the biggest thing is we're loosening up the trigger points that can be referred down into the arms and the hands. And that's extremely important because sometimes when you're pushing here, you'll feel it underneath here and go around to your mid-back area. So we want to address everything that can affect that area. Sometimes it's direct, sometimes it's indirect. So when you're standing up, you can take the tennis ball and then put it in those hollow areas. You just start kind of pushing in and you sink. You don't roll it around and do that. You feel for the point, you'll feel it. It'll be tight. You just hold it there, stand against the wall. Of course, you won't be hanging on to it with the other hand, but push up against the wall and then just keep moving it around. And eventually that referral feeling that you're getting down in your arms and hands will start to let up. And then also you'll notice you'll start feeling a shifting underneath here into the rib cage area as well. And that's a good sign because then things are shifting and moving around. So you want to make sure to do that on both sides and get those areas. And then if you wanted to, especially like if you're standing up at work, it's not very feasible to lay on the floor in front of your coworkers. So what you can do is take the tennis ball and put it in between your shoulder blades and work in that area as well too. I would first, do the stretches like I was telling about you, especially at work. You could stand in the doorway, you wouldn't have to use a towel. But then you could also take a tennis ball like on your lunch break after stretching out, and then you could work in here and in here with the tennis ball on your break as well. And then there's another tool that I love using for trigger points, either when I'm standing or sitting, that's very handy, especially if you are going on plane rides or in areas you can get up and move around a lot during that time. This is also great for releasing tension as well. So this has two sides. This is the back knobber too. If you're in a country, I have a type of link where if this isn't available, a lot of times something else that's comparable will show up. So that might work for you. But if you can get this one, but I take it in and I go in different points by my shoulder blade and you'll feel it. And then you just stay on that spot. There's one that's going right down into my arm. You stay in that spot and let it sink in until that referral is gone. You got to remember, don't push it too hard. You just, like I say, sink in, because the harder you try to push it and then the body starts, what it can do is can overstimulate the nervous system. And that's counterproductive to what you're trying to do. You're trying to get the body to relax, not overstimulate it. And that overstimulation can cause it to tighten up and make it guard and make it worse. So then it's hard for your body to relax again. So you sink into it and you just keep going in different areas, especially right there, different areas along your shoulder blade region, and just work your way up. You don't have to, depends on how much time you have and how your body is releasing. As far as an exact time of holding it at each point, I don't necessarily have that because I don't know what your body is doing. Everything I do is very personalized, very individualized, because everybody's body responds, reacts different. They've been through different traumas, they've been through different experiences. So to put everybody in a box, it doesn't really work that well as far as how I work. But if you do want kind of a gauge, I would say a minute or two. If you can, if something's really, really tight, just stay on it longer. Like I say, listen to your body. That's actually going to be the best way to tell how long you should do something, is to listen to your body and feel it for how it responds. Because the biggest things that I show is when I say listen to your body, it also connects you to your body again. A lot of times when we're working, when we're functioning, we're so focused on just living life, we get very disconnected from our bodies, and we don't notice it until, oh goodness, I all of a sudden have this pain between my shoulder blades. Then, well, how'd that get there? And so, well, it's because of what we've been doing and not paying attention to our bodies and just living our lives. It's not good or bad, right or wrong. It's just the way it is. So when I say listen to your body, tune into that, reconnect with your body, shut other things out, feel for movements, feel for shifting, feel for differences. That's extremely important. And by reconnecting with that, it will help and facilitate your healing a lot better and a lot faster. So when you go through, you can, like I say, go through those points. You can even get up in your neck if you want. There's some really, really good spots through there. To treat the mid and upper back as just one area is pretty tough, because a lot of times you need to expand into the neck and expand into the low back, into the pelvis. As I said earlier, it's all connected, and over time you will start feeling pain in those areas too. It shifts and changes. So you do want to address multiple areas. So you can get up into the neck and work those down, especially if you suffer from headaches a lot. A lot of those trigger points will come down through here, in here, up in here. All those areas will need to be addressed, and you want to make sure to watch those and look out for those. And then if you want to, you can go anywhere with this tool. You can go into your low back, especially around your sacral area, around that sacrum, around that bone, that triangular bone in your pelvis, and just play around with it. Just play around like, ooh, that's tight. There's a spot, especially your low back. Work up into your mid back, into your low back, especially down in here, because what happens, especially if you're rotated, this area here, right here, this part of your back, takes a lot of the brunt. It takes a lot of that rotation. So by releasing that, that will also help your spine line up better like it should again and stay centered. Now I'm going to demonstrate various techniques that incorporate a lot of trigger point work, myofascial work, and then also the spinal decompression I was telling you about. I will be addressing the back side, and then also I will be addressing the front side as well. And I'll be using various tools. And like I said before, depending on the country that you live in, what I suggest may be available. If not, it should pull up other recommended items that are available in your area. And a lot of things I use are basic things such as a tennis ball and towels that work just great. The other tools are just to kind of take it a little further. So what I like to do, this is part of my nighttime routine before I go to bed, is I will start out clear at my neck. I will create a tractioning to start out with, because of course everything's attached. So I'll start with that, either using this traction type of device, or then also what you can do too is you can take a big towel like I had before, and you can roll it to create a neck roll to put behind, and then that can also be your traction as well, and you can do it in different levels depending on how thick you make the roll. But what I do is I like to use this one because it gets clear down in my upper back area. So I'll take it and I'll put it underneath and I'll just lay on it for a while until I feel that tension. And I like laying on a flat floor because then it helps make everything shift and then just settle into more of an alignment. And then you'll also notice as you're laying here, you'll notice where your pelvis sits and where your shoulders sit, especially if you have that big curve in your upper back, that will start to flatten out. And you'll just lay here probably, especially with this one, I use it for about maybe 5 minutes. I don't do it for too long because it can be counterproductive and actually cause some numbness up here in the base of your head. So you want to do just a little bit, enough that it just kind of opens everything up and does it that way. And of course, if you use a towel, you can use a towel for a little bit longer too. It's a little softer. It's not quite as intense as this is, but this is really good for getting in there a little quicker and opening everything up. So like I say, around 5 minutes or so. And then what I usually do is I take this out and then I start working down the rest of my spine. And you can do tennis balls if you want. Sometimes what I can do is take like this, where you take a sock and then you put 2 tennis balls in a sock. So you put one tennis ball in, put another tennis ball in, and then what you can do is you can tie it so that way the tennis balls stay nice and close together. So when you do that, you have the 2 tennis balls together and it creates a valley for your spine to sit in. And what you can do is you can use one. It might be too intense for some people, but if it's too intense, I'll show you an adaptation here pretty soon. So you kind of lay on it, and like I say, it is very, very intense. And if you're not able to handle that, that's okay. What you can do is you can start out with folded towels. You can take a couple hand towels and put it into thirds and do that, and then do it again with the other towel and put it into thirds. Actually, it works better if you fold it this way, and then fold it in half and then put it into thirds. And then what you can do is you can put those 2 towels together, put it between your shoulder blades, and then just kind of lay here. And as you can see, it helps everything open up and roll back. And it's a lot better option for people if they're super, super tight or really, really curved forward. So you can lay here like this for a little bit. I would say a good 5 minutes or so, and you'll feel like everything start opening up and everything. Another option too is you can take multiples. You can line multiple different ones up like this. Take that out here. And you could do maybe even 4. See how you feel if you put, that actually feels really good. If you put multiple of them like this, it's not as intense as if you're only using 1 sock with 2 balls. So right now I have 3 socks with 2 balls each. So it's creating a lot better kind of lift over a longer area. So it's not so intense just with 1. And it's actually making my back relax really fast because it gets into the trigger points of those erector spinae muscles that go all the way up and down your spine. And I don't know if you'd really want to lay here for 5 minutes, but probably for a few minutes, just so you can feel that release going on. And if this is still too intense, what you can do is you can lay a thick towel over it. So if you wanted to, you could lay your towel over it and do that. Or you could also do a 4th one. If you wanted to do more of your spine, you could do another sock with 2 balls in it, 2 tennis balls, and create a really, really long area if you want. And then that would really get your spine. So just make sure that that helps a lot if you put a thick towel over those balls, and then it's not quite so pushing in to the rib cage, which is good. So that's an option. Another thing I like to do is with this one, this is actually for cranial sacral, it's not necessarily meant for this, but it works really well for me, is, I'm going to move this over, is I start, it's not quite as hard as the tennis balls, but I'll start up at the top, I'll relax around it, and so it's stretching out the distance between my vertebrae and creating that space for the nerves and all of that to open up. And then after I'm on it for a minute or two in each area, I'll move it down and make sure you're centered on it. And then as you go down, you will notice, as things start to release, you'll notice some shifting going on. Like where I'm at now, I'm about right here in my back, and it's sending tingles down into my leg. And you will really feel how interconnected everything is depending on where you start releasing in the spine. And as you work down here, even especially with the tennis balls, be very, 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 very careful, because as you get lower, you get into smaller ribs, and you don't want to put too much pressure on your ribs, especially in your lower rib cage. You're going to be careful with that. But as you slowly work down, there's going to be areas that are super tight, that's very, very surprising. Actually, where I'm at now, I'm about right here. It's very, very tight. I feel it going down into my leg. I feel it going down into my hips, my pelvis, all this area. And if you do have low back stuff going on with your upper back as well, a lot of times it's very common for both of them to be painful. By releasing this area in the lower part of your mid back, almost the upper low back area, it releases all of this down in here. You will feel a huge relief, and you'll start feeling your pelvis move back and forth. And sometimes you'll feel it in your neck. You'll start feeling like a shifting going on in your neck and your head. And that's a good thing to do for that. But what you can do too to start getting into this is, especially if you're on the tennis ball area, this one might be too intense for doing this, but I'm going to do it just for demonstration, is what you can do is to start working the front area to get all these trigger points and everything opened up here. You can use a tennis ball if you have that, and you can go in and you just start working it, just feeling it, kind of wiggle it back and forth. Don't force it. There's going to be areas that are like super, super, super tight for you, and you want to make sure to do both of them and get down into your shoulders as well and move those around. Kind of move that back and forth. Make sure you get those intercostals. Like I say, those are the muscles in between the rib cage. And even around the breastbone, and kind of wiggle that down and move it down. And then another tool you can use is, I got this set. It's 2 different weights of ball peen hammers, and they're actually quite effective. If you start with the heavier one and you start working in those muscles and really get into those intercostals, like I say, be very careful, and you can really, really feel the amount this is getting into for those muscles, and it'll tingle like crazy. And what you might start feeling is as you're working the front area, you might notice you're taking bigger breaths. It's easier to breathe. So you just keep working this around to different areas. And then it has a smaller one where you can get even more precise into those areas and start working down in the intercostals by the breastbone, but be very, very careful. This is a very sensitive area. So you just lightly start working that. And what you can do is you can start working down into your ribs down here and start opening that up. And you're going to find some spots that are very tight and very, very sore. It's amazing how much tension we hold in between our ribs that you'll soon discover. And then you just start working around going to the back. And then another tool I have used before too is this one, where it covers a bigger area. So this is actually a fascial tool that you can use for trigger point work too. So what you'll do with this one is you can push in a little bit and then slowly take it out. And you can go clear in to your shoulder. You can even work the front of your shoulder to help loosen things up as well. And then you work down in between your breastbone here, and be very, very careful with it. And you can even get down into your abdomen to kind of help open this up a little bit too, but be careful with that as well. But if you don't have any of that, and as far as the myofascial part of it, to open up this connective tissue, you can use your fingers. And what you want to do is you want to engage the tissue, hang on to it, and then stretch up and out. Carry it all the way out into your shoulder blade. And what you can do too is go up in and over the shoulder blade, in and over the shoulder blade, because the goal is to get in. You'll feel how tight that is. If you go right under the collarbone, the clavicle here, if you go right underneath that and push into that right next to the joint, you will feel how tight that is. And this area right here is a main area that pulls you in like this. It's very big. It's a very big culprit when I work on people, how tight this area is through here. And this is also what causes that backside of the shoulder blade to wing out. So you want to make sure to address that. And so then as you go down, of course, bare skin works the best. I'm not going to do that for demonstration purposes, but in your own home, you can start working down. And just like I say, like you did up here, you just engage the tissue and you move out, engage and move out. And make sure you get in between those ribs, get into that rib cage. And this is great too, especially if you have conditions such as asthma and that kind of thing, where your lungs are just always feeling compressed, or allergies or anything like that. So that way, or if after you've had a bad cold, so get this opened up. So you'll feel in between your ribs, those areas, and all this compression and everything. Once you get that opened up, you'll notice a huge difference. And once this is all opened up, then that's going to take the pressure off the backside in between your shoulder blades and your upper back, and you will notice a huge difference. And then also what I do too in my own self-care is I have something called the chirp wheel. It comes in like a set of multiple different ones of various sizes. I personally like the smallest one. Again, I'll put the link in the description. But I like this one because it has the space right here for the for the spine, so that way you're not rolling your spine on it. But they have different versions they've come out with, and then so I'll show you, like, just for the small one, I make sure my spine is in the center, and then I lean back, and then I roll. I just kind of roll and I hold it, and then I come a little bit and I hold it, and then I come a little bit, I hold it. Eventually, I'm able to roll completely up and down. I personally like this better than a foam roller, because a foam roller goes all the way across. I want something that gets me specifically right between the shoulder blades and lets everything else drop back. So that's why I like this one. But again, I'll put the link in the description. So once you do all these various things, and feels better already. Once you do all these various things, what you can do is you can measure yourself again, stand against the wall and measure your height again. And you might be surprised at the difference. And it might take a few days of doing this. You could do these techniques multiple times during the day, especially if you're on vacation or during the weekend or something like that. You have more time, you can do it throughout the day, and that will help break up the pattern. And you may notice some shifting throughout your body, even when you're not doing it. It's just your body moving and changing and trying to find that center again, how you're training it the new way for it to stand, and how gravity impacts it. So these should work out really well for you. One other spot I'll cover right quick. I know I showed the tennis ball against the wall and with the back knobber. You can also work it here on the floor too. And also one muscle I didn't get when I was standing up that you could do against the wall is the one right underneath here. You'll feel that one. But what else you can do is when you lay down, you can lay flat and then put the ball underneath. And as you roll, oh, you will feel that big time. You might even like this better than against the wall because it's really, really intense. I mean, in a good way. It's one of those hurt so good feeling type things. It's not uncomfortable unless you like really, really push into it and try to force it. But if you just work with your body, and you'll want to get like right into that joint because you'll feel that, and then it will be super tight, especially if your arms are forward all day. You can feel that. And then the one under here, what you can do is you can kind of come up just a little bit, and actually it works best if you're on your side, if you're able to sustain it and hold it. And it's right here, right underneath your shoulder blade in the back. So it's on the side. And that's a major muscle that goes up into here, and it tingles all the way up into my arm and my hand. So that is another good one to try to get to. And like I say, with a lot of these points, you just want to be very, very careful. You want to listen to your body, and you want to go slow. So that is the main concern. As far as exercises, one huge one that helps me a lot is the trap pulls. I don't know if you've ever seen the cable equipment where you take it and you pull it back, take it and you pull it back. Some people do rowing. Rowing is good too, but for me, rowing doesn't get this top like I need it to. And what rowing also keeps compressing this area as you row. And I know you're going back like this, but you're still compressing this area. So I like to stand and work the traps because creates this posture where I'm already standing up. I already have my core. And so then I usually put my legs apart a little bit and straight, and then I'll take it and I'll work in different areas for the trap pull. So I will do the pull down to get the triceps. I'll pull back like this. The more you can adjust where you're pulling from, the different areas you will get to in your upper and mid back, and you will feel it. And so what happens by strengthening that back, you actually don't have to focus on trying to force your shoulders to go back and stand up straight. Your muscles, your body will just naturally do it because you're strengthening that. You're bringing that, especially the erector muscles that I was talking about, it goes from the head to the base of the back and to the pelvis. You're strengthening all that. So that naturally makes you stand erect and stand up straight. You don't have to force yourself to think about it, force yourself to stand up straight. You'll just naturally do it. You won't have to force anything. Like I say before, because you have facilitated your body, you didn't force anything. And that's extremely, extremely important. Another thing you want to remember to do is go for walks, especially where you're in a position where you're not moving around. I know sometimes I'm very guilty of this, where I'll get so focused and pretty soon 3-4 hours will go by and I'm like, I didn't get up and move around. I didn't drink water. I didn't do anything just because I was so focused on what I was doing. Or maybe you have a deadline you're supposed to, maybe your boss is like, hey, we need this done by this time. Or you have several patients or clients in a row that you're seeing and you don't get the time to take a break. It's just go, 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 go. So when you can, anytime at all, even if you have a 15-minute break. I know when I was working for an admin, I would get out and go on my breaks. I would go for a walk each time around the parking lot. And it makes a huge difference in how you feel, the fluid retention in your legs, and getting that mobility through your entire spine. It's extremely beneficial. And a lot of things what I enjoy doing is drinking a lot of water, especially electrolyte water, because the calcium, magnesium, and potassium is very, very important for your muscles and your nervous system. So you want to drink a lot of that. And then I will drink that, and then I will go for a walk to help get the fluid in between the disc, the connective tissue, everything. I tell my clients this a lot, especially when I've done a lot of connective tissue work on them. So that way the fluid can get into the tissue now that the tissues have been realigned. And I'll say, if even just a short walk, just get that fluid in there, get that mobility in there. And I've noticed a huge difference in people when they do that. And we keep working on getting everything loosened up and working layers that way. So walking is extremely important, and just moving the body, because the lymphatic system, the fluid that goes around your body, needs that movement, because the movement is the pump. It acts as a pump in getting the fluid everywhere it needs to go. And if you don't move, that pump doesn't happen. And so then stuff doesn't get flushed out like it should. It doesn't circulate like it should. The oxygen might get lower because you're not getting your blood flow everywhere it should go. It can make you drowsy, sore, extremely sore by the end of the day, because you've been in that position and you haven't moved. So if you can, walk as much as possible. I personally like walking better than running. I've worked on a lot of runners, and they do tend to get a lot of problems eventually in their hip and their knee, just due to that constant compression on those areas. So walking is great because it's not a high impact, unless you're speed walking and doing cross country up mountains and hills and all that stuff. That feels pretty good too. But even just a small walk around the parking lot is huge. The techniques and exercises we discussed should help reduce your upper and mid back pain and tension. And you'll also want to remember, it's not just what we did and incorporating movement. You want to pay attention to how you live in your body throughout the day. For instance, on your setup that I was just talking about earlier, as far as the cause, are you leaning in your chair? Is your chair uneven? Is the floor uneven that your chair sits on? You could even get a level and try to see where the level sits. You might be surprised, especially if you have a rotating office chair. Depending on the direction your chair rotates, the bubble in the level will change. And then also, if your floor is crooked, it's going to affect your chair. So even if you have a small, slight difference in the level of your chair and the floor, over 8 hours or more a day, that is going to add up, because your body starts compensating for that shift. And it may start your low back, but it's going to start working on up into your mid and upper back. And then pretty soon you're doing the side shift thing. So it starts taking your spine out of where it needs to sit for the center. You also want to pay attention to the setup of your monitors, especially if you have multiple monitors. Say you have 3 monitors, and you spend more time looking at one monitor more so than the other. Say you have several different applications open, and you focus more on one. So instead of putting that one in the middle, just for the flow, it's easier to put it over here. Eventually, you're constantly twisting. So if you stay twisted like this and then turn your head the other way to look at the other monitors, or vice versa, if you're over here, you're turning here, it's compensating all the way down, and you're creating a pattern. So if you can, I personally love the curved monitors. I had a 42, I think it was 42 inch. I had a big curved monitor, and it was awesome. By having one curved monitor, it reduces that space in between monitors. So it gives you more production in between that space. So you don't have the space dividing up the amount that you have to turn and rotate to see all the monitors. So that is also something to think about. Be mindful of your phone position. I am just as guilty as anybody else, and I should know better. I will watch social media on my phone when I'm laying down. Shouldn't do it. It also creates a lot of forward tension. I do notice I not only start getting pain in my mid and upper back, but I also start getting pain where I'm holding my phone. So if you can avoid doing that, that is ideal. Like I say, I'm guilty of it too, and I need to be better about it as well. So you want to make sure to be conscious of what you're doing with your phone, especially if you're holding it down like this and doing this a lot. If you can, bring it up so that way it takes the pull off of these muscles in the back. That would be ideal. Or watch it on a computer, or I know a lot of people watch them on smart TVs, especially YouTube, and that works out well. So anything where it takes this constant pulling down is ideal as far as phone use. And also hydration. I touched on that earlier. Hydration is extremely important for every part of your body. Our body is mostly made up of water. So not only water, but the electrolyte water, such as the calcium, magnesium, and potassium, that can be extremely important, like I say, for the muscles and the nerves. So you want to make sure to drink plenty of that during the day as well. And also we want to be mindful of how we sleep. Like I have said before, if you're in that forward posture all day and then you sleep on your side, so you sleep on your side and then everything's rolling forward, so that whole backside is getting stretched out. And that's not only that, but if you don't have support between your legs and support between your arms, because of that rolling, it also starts rolling your hip forward as well. Or you may sleep that way where you have constantly one hip, like your bottom hip is back and the top hip is forward. So that is creating a rotation already in your spine. So how you sleep, especially if you're a side sleeper, is extremely important with how things get set up. And when you sleep, you want to make sure to have a pillow between your legs and between your arms. And then also, like I said before, in that hollow underneath under your low back, because otherwise it creates a hammock. And then that low back sinks down. And then same for your neck. You want to have your neck supported in between here, not just your head. Because if you're just supporting your head and then you're laying on your shoulder, so the center of the neck is dipping down and is going towards the bed and the pillow. So that's also something to think about. If your pain is accompanied by shortness of breath, numbness, tingling, chest pains, you want to make sure to get that checked out by a qualified physician. I'm not a doctor by any means, and all the information I have shared is for informational purposes only. So you want to make sure to double check it with your physician to prevent any possible serious situations that may happen. If this information has been helpful for you, let me know in the comments. I'd love to hear about your experience. And then also feel free to share this information with friends and family who also might be dealing with upper and mid back pain. It is a very common problem that many people are looking for answers for. And then also like and subscribe and stay tuned for more self-care tips.